There's an example of what the chiropractic approach to a mid-thoracic restriction would be. After the assessment and the diagnosis, this client kindly has allowed us to use this footage with her in it, which she has had. What we would do is then go into the treatment. So loosening up some of the muscles around the joints, important, and then finding where the restriction may be on that day. Usually it will be in the same place on the subsequent treatment. So we'll do what we would call a motion palpation and see if it's in rotation or lateral flexion or extension or flexion. So we'll check all the movements out. Once we've found out through that, we'll get the person to go in a position where we can press and spring on the vertebra, which will get you to please lie in your front. And then so palpation will be over the spinous processes, trying to sort of elicit an area of restriction. Once that restriction has been found, which we have done before we've started filming, so we know where it is, we would go into looking at how to loosen the muscles up with, again, soft tissue, and then the adjustment. So one way would be on the chiropractic table to use a similar type of adjustment to that. But what we'll do is move over. So if you don't mind coming up over to the table and coming over to here and just lying on your back. Different techniques are used for different people, and in this technique I'm going to use a anterior adjustment position. I'm going to use this part of the hand and close it like this so that the vertebra come into the middle, and what I'll do is adjust on one side. So I want to get the left hand side, so the right hand side of the thoracic spine. So as I come under, I get the patient to put their hands on the shoulders, to tuck the chin into the chest, to slowly raise up with a bit of assistance. I'll keep my hands ready, put them underneath so I have contact on the vertebra that needs adjusting, and as the patient breathes out, I'll lower them down gently, and we'll gently do a small adjustment, a fast, so high velocity, low amplitude thrust administered through the area of restriction, usually accompanied with an audible pop. That's just the sound of gas as it escapes from between the joints. Will help the joints free up, improve the movement, reduce the pain and some of the symptoms. So that's one technique that we can use for the mid-thoracics. Then we'll check again to see if it's moving better. So if you don't mind coming up, have a seat once more in the middle. And we would then go through the process again, same as before, pre-adjustment, and make sure that on palpation and on movement that it seems to be moving